organize, agitate, organize, agitate. All right, thank you. Thank you. I just wanted to note really quick, I don't know if any speaker, because I've been running around so much, but the Violence Against Women Act that passed, it did pass, 68 to 31. Guess who the 31 that voted against it were? Republican men. The 5 Republican women that voted on that act voted to pass it. Even Republican women get it. Okay, this isn't about Republicans and Democrats. It's not our fault that the Republicans have chosen toxic policy to force down our throats, but we are going to do something about it. All right, I just had to say that. Our next speaker is Dr. Kathryn Luchok. She's been a public health consultant for 20 years. She has headed up projects in the United States and in developing countries. She has faculty appointments at the University of Kentucky College of Medicine, USC in Public Health. I apologize for my scribbling here. She's a former Director of Policy and Research at the Southern Institute on Children and Families, former Director of the South Carolina Access Initiative, and a founding member of South Carolina Coalition for Healthy Families. Please welcome Dr. Luchok.
Oh, hey, the sun's come out. As Chris has told you, I've worked most of my life to try to improve the lives of women, children, and families around the world and also here in our fair state. And today I've come here to tell you that it's time to wake up. I think a lot of you folks are awake, but maybe you have to go out and shake up the people next to you and get them to wake up. Because what we're talking about now is that we have to be present, because right in our own backyard we're seeing the ravages of neglect, of the policies, the programs, the laws that don't protect our community. We've been seeing chipping away at our reproductive rights, and here are some of the results of that. Here in the Midlands, the combined counties spend nearly $2 million taxpayer dollars a year, in 2009 actually, on the cost of teen childbearing. We have a state that is one of the hot spots for HIV/AIDS cases, and here in Richland County we have one of the highest new instances of HIV and AIDS in the state. 58% of all pregnancies in our state are unintended, goes up to as high as 90% in some subgroups, and is a continued problem because unintended pregnancy leads to unintentional parenting. Inequities exist in affordable health care. We have actually 6 out of 10 women who use the family planning clinics as their only source of health care, and yet we have a Congress in the United States who's looking to defund the Title X program, which funds those family planning clinics. How are we going to help people really get a handle on their reproductive health care if we start taking away all the funding that helps them? So instead of having policymakers and politicians really focus on these kind of problems, we instead see special interest groups really working hard to strip us of our basic human rights and bend us to their own particular agendas. We've seen science trumped by fear. We've seen myth instead of compassion. We've seen shame instead of empathy. We've seen religious tyranny instead of religious freedom. We have all levels, at all levels in this state and really across this nation, we have a basic reproductive illiteracy. People don't understand how their bodies work, they don't understand how to protect themselves, they don't understand how to use contraception, and people that are making laws about this don't understand any of that either. It's up to us to try to get out there, as it says, to organize, to educate, to advocate. So what I'm saying is that each one of us has to take up a shovel. There is a stump of ignorance in this state. And each one of us has to be responsible to take up that shovel and start to dig little by little. Take a teaspoon if you need to, but you gotta be there, you gotta be present, and you gotta start digging. For the past 3 years, I've had the pleasure to work with the South Carolina Access Initiative, and I want to give a shout out to Shannon Staley, who's still working on that project, and was one of the people who helped organize this with Chris. And one of the things we're trying to do is to become reproductive health warriors and to get other people to be reproductive health warriors. And what is that? That's people who go out and advocate for the real education, real comprehensive sex education, availability and affordability of all contraception, having women be able to choose when, where, whether, and how to have a baby, and to be able to take care of all the babies that they have, to be free of violence and environmental toxins and political toxins. Another person who's not here today is Linda Robinson, a family planning nurse who's been the lead trainer for the South Carolina Access Initiative, and herself the lead reproductive health warrior. She coined the term. She is trying to normalize instead of dramatize all things about sex to help people have safe and healthy sexual relationships. She fosters connection and caring, and that's what we need to move our policies and our legislation forward, to make sure that we are all safe and healthy, and because we all are sexual beings. She explains that health warriors at their most basic are committed to reducing suffering by making sure that people develop responsible decision-making regarding their sexuality. And to be responsible, people have to have the knowledge of their anatomy, healthy relationships, types of intimacy, ways of thinking, ways to avoid distress, disease, and unwanted pregnancies. We need honest, straightforward, comprehensive sex education in our schools and in our homes. When a teenager's old enough to drive, do we throw them the keys and say, good luck with that? I don't think so, but every day as a kid becomes able to be sexually active, we turn our backs and let them go off on their own. We tell them just don't do it and hope that they won't. Well, as you know, we won't have a species if none of us have sex anymore, right? And so we've got to have people understand, though, that there's responsibilities and there are ways to take care of themselves to be actually sexually active and functioning people. In Europe, we see comprehensive sex education, complete access to all kinds of contraception, people talking about sex at the dinner table, and we see that abortion is legal and available, and yet in these places we have much lower rates of teen pregnancy, we have much lower rates of unintended pregnancy, much lower rates of STIs, much lower rates of abortion. So what are we doing here? We're doing the exact opposite, and we see all these things just coming out our ears. There is another way, and we have to start pushing to make sure that other way is what functions. Basically, when people understand that the power of love and sex is something that we need to take stock of and learn to take responsibility, then the lives and the prospects of future children, individuals, and families can actually thrive, not just survive. In order to do this work, reproductive health warriors must smile and lean into the discomfort of their work and the ways that they cultivate authentic connection and open and honest communication. Without the courage and commitment to do this heavy lifting, it'll be impossible to improve health outcomes for our most valued possession, our young people. So, stay present, wake up, shake up, take up a shovel, and let's get this stump out of here. Be a reproductive health warrior, and thanks for listening.